Oh, not this guy again. He's gonna freaking be long-winded and repeating questions and... all right, here we go.
You have to answer yes, sir.
Yes, sir.
Could you tell us where you're currently employed?
Sure. I am a cardiologist at Northwestern Memorial Hospital in Chicago, Illinois, where I also am an associate professor of medicine at Northwestern University.
Dr. Rich, what have you come to talk to the jury about today?
I'm here as an expert cardiology specialist to provide my opinion as to how Mr. George Floyd died.
Have you ever testified in a court of law before?
This is my first time.
Would you briefly summarize for us your educational background?
Sure. So I attended the University of Illinois in Urbana-Champaign pre-medical coursework.
What a residency is?
Yes, I do know what a residency is.
Would you tell the ladies and gentlemen of the jury what a residency is?
Sure. So after completing medical school, I went on to do training in internal medicine. And that training is referred to as a residency.
I have this on
I believe
1.5
the term originated
people.
because you seem to spend all your time in the hospital. You were basically a resident there. And so that was a 3-year internal medicine residency.
And where did you do that residency?
I did that at the Brigham and Women's Hospital. So upon completing internal medicine residency training, many will go on to practice.
Do your fellowship.
So I did my chief fellow.
What is a chief fellow?
So every fellowship program has about the honor to be. Yes, I did.
What was that?
So after completing cardiology fellowship, I decided that I wanted to heart failure. I am board certified in both cardiovascular diseases and in advanced heart failure. So thankfully, most people are not going to need a heart transplant, but on occasion, patients' hearts will worsen over time and get to the point where they're tremendously weak and can't function on their own anymore. The medicine isn't working. And so the field of transplant cardiology is one in which we try to see if we can find a suitable match for that individual.
Advanced cardiac life support?
Yes, I am. And I renew that training every 2 years as part of my job. Right. So after completing the heart failure and transplant fellowship, I took my first position at the University of Chicago as one of the heart failure and transplant cardiologists. One of them is I am the medical director of the Mechanical Circulatory Support Program.
Mechanical Circulatory Support Program.
Right.
Now, what is that?
Yeah, I'll keep it brief. But basically, we talked about heart transplant for a minute. So patients whose hearts become very weak and perhaps they're not a good suitable match for a transplant, or they just don't have time to wait for a transplant, we can implant mechanical heart pumps that, combined with their weakened heart, can restore blood flow to their body to improve their quality of life and allow them to live longer. The advanced heart failure and as a cardiologist, I perform a lot of clinical work.
Clinical work as compared to what?
Absolutely. Clinical work basically means patient care. Okay, so it's the actual acts of taking care of patients, whether it be in the hospital, outside the hospital. Teach the students, residents, help cherish, and have been doing so in a variety of cardiovascular. Yes, that is for sure the most intense. My clinical. So I spend several months, sometimes basically the sickest heart disease patients. Duties is I see patients, close to 50% of the patients with medical conditions. Procedural suite we call the cath lab, where I measure pressures inside the heart and inside the lungs. And sometimes I will also take small biopsy samples of the inner lining of the heart for diagnostic purposes. So I work with a tremendous team at Northwestern.
Involved in determining the cause of death?
Oh, yes, I do.
Could you explain?
Sure. One of the most important parts of my job, in fact, is to determine what's wrong with the patient, including if they do actually die, how did they die? And so there are a number of ways in which I participate in that role of figuring out.
Are you involved in any hospital committees that have as their purposes?
I also participate on a committee to try to figure out our overall. Yes, so I also participate in clinical trials where we try to determine why did the death happen, for a reason that, because I am a cardiologist who takes care of patients in the intensive care unit, having low oxygen levels is not uncommon. A lot of different disease processes can cause it, and low oxygen levels can be very detrimental. Some of our patients require ventilators and respirators, and so in the course of caring for these patients, sometimes they succumb to their illness because their body is not able to get enough oxygen.
Do you ever have to determine cause of death in the heart transplant context?
Yes. So in the field of heart transplant, they as closely as other parties who we're trying to help, and so that's another element where you have to be really.
I'm going to pause it and go to where he starts talking about George Floyd instead of bumping it.
Back to this case. Every year, I take on a number of professional activities without compensation. I actually think it's a duty of our field, and so in this case, I felt I can make a meaningful contribution to the medical field.
So for your the compensation for your time while you're here at trial, are you being compensated at $1,200 per day?
Yeah, it's $1,200 a day while I'm missing work back at home.
Right. So let's talk about then your opinion or opinions in this case. Before we do, could you tell us what work you did? What did you review before forming opinions in the case?
Sure. So I was provided with a lot of evidence to look through, but mostly I looked through the medical records, interviews, all the videos that were provided to me, and the autopsy report.
Did you review some journal articles as well?
Yeah, as I was formulating my opinion and creating my expert report, I also looked up journal articles and embedded them into my report for references.
Have you formed any opinions in this case to a reasonable degree of medical certainty as to the cause of Mr. Floyd's death?
Yes, I have.
Would you tell us your opinion or opinions?
Sure. In this case, Mr. George Floyd died from a cardiopulmonary arrest. It was caused by low oxygen levels, and those low oxygen levels were induced by the prone restraint and positional asphyxiation that he was subjected to.
No mention of the drugs or heart problems. Wow.
Well, let's discuss your opinion, Dr. Rich, and let's start it with just a general discussion of the circulatory system in the heart. So I'd like to talk about the right side of the heart, left side of the heart, and also the alveoli. Would you start off and just tell the jury, just remind them, what are the alveoli?
Sure. So you might remember hearing about this, but the alveoli are those grape-like structures that are at the very bottoms of the lungs. The alveoli is where the actual gas exchange occurs, meaning that is where, when we take a breath in, oxygen gets across the lungs and into the bloodstream, and then the carbon dioxide that needs to leave the body crosses that same barrier into those alveoli. So when we take our deep breath out, that's how the carbon dioxide is removed. So it's the alveoli of the lungs that serve that purpose.
And again, what does a heart do in the body?
What does the heart do? Well, the heart is the major pump, of course, of the body. The best way to think of the heart, in my view, is to actually think of it as two pumps, sort of a right side and a left side. So if we start with the right side of the heart, after all that blood got pumped to the body and is coming back to the heart, blood is always returned to the right side of the heart. So this is now blood that presumably does not have much oxygen in it, and it needs to get more oxygen. So that right side of the heart, its job is singular. It is to pump blood to the lungs, to those alveoli. So the blood, when it heads towards the lungs, it can pick up that oxygen that it doesn't have right now, and it can deliver carbon dioxide and other acids and waste products to be expelled from the body. Once that blood from the right side of the heart has picked up the oxygen that it needed, it sends it to the left side of the heart. Now, the left side of the heart gets all the glory because it is what then pumps all of that oxygen and nutrient-rich blood to the entire body, meaning to the lungs, to the kidneys, to the brain, to our muscles, to deliver oxygen, because every organ, every tissue of the body needs oxygen in order to function. And then once that process occurs, it repeats back to the right side and so forth.
And what happens if the lungs can't deliver sufficient oxygen to the heart? That is, if there's a low oxygen situation.
Okay, well, the heart is only as good as the fuel that it's provided with. So when that right side of the heart sends blood to the lungs and says, okay, can I have some oxygen, please? If there is no oxygen there, or not enough oxygen there, there is nothing the heart can do to extract more from the lungs. So it has to take that deoxygenated blood, that blood that does not have enough oxygen, and pump it to the left side of the body. The left side of the body says, okay, this is what I have. This is what I'm going to pump now. And so what ends up happening is if the lungs don't give enough oxygen to the body, the heart then has to pump insufficiently oxygenated blood to the tissues of the body, and that's when problems occur.
Well, then returning to your opinion, cardiopulmonary arrest caused by low oxygen, induced by positional asphyxia. What caused the low level of oxygen in the case of Mr. George Floyd?
Well, in his case, it was truly the prone restraint and positional restraints that led to his asphyxiation.
Nothing to do with the drugs. Wow. Or his bad heart.
In a nutshell, he was just simply unable, using all of his muscles of respiration, his chest wall, what we call accessory muscles of respiration, which are extra muscles that will be triggered in the event that you're having trouble breathing. He was trying to get in enough oxygen, and because he was unable to, because of the position that he was subjected to, as we just discussed, the heart thus didn't have enough oxygen either, which then means the entire body is deprived of oxygen.
So, low oxygen induced by positional asphyxia. Did you consider other possible causes of Mr. Floyd's death?
Sure. I tried, of course, to be as thorough as possible, but I focused mostly on two other potential causes. Number one is whether there could have been a primary heart contribution to George Floyd's death, and the second was whether a drug overdose could have caused his death.
So, doctor, would you tell the jury what is a primary heart event?
Sure. So, a lot of things can injure the heart. For example, if you do not take in enough oxygen, that will injure all the organs, including the heart. When I use the term a primary heart event, I mean something that originated from the heart itself. So, for example, a heart attack. All right, one of the arteries of the heart just suddenly got blocked completely, and a heart attack occurred. Or the heart just, without any explanation, nothing else secondary inducing it, went into a serious ventricular arrhythmia. Okay, so the bottom part of the heart, that part that we were talking about that needs to pump blood to the body, suddenly went into a chaotic rhythm all on its own. If any of those things happened, then I would consider that a primary heart issue, not being caused or secondary to something else.
So you considered whether or not Mr. Floyd might have passed away from a primary heart event or a drug overdose. Did you reach an opinion or conclusion to a reasonable degree of medical certainty as to whether either of those two causes explain Mr. Floyd's death?
Yes, I did.
Would you tell us your opinion?
Sure. After reviewing all of the facts and evidence of the case, I can state with a high degree of medical certainty that George Floyd did not die from a primary cardiac event, and he did not die from a drug overdose.
Thank you, Dr. Rich. Would you tell us what evidence or facts, documents, what did you look at to help you to reach that conclusion about primary heart event and or drug overdose?
Sure. The three aspects of the evidence that I spent the most time reviewing were Mr. George Floyd's medical records, the videos, the different angles from the day that he died on May 25th, 2020, and the autopsy report.
So the medical records, the videos, and then the autopsy report.
Yes.
Let's start with the medical records then of those three.
The problem, I felt pretty confident that Mr. Floyd had three medical problems. Number one, he had hypertension, high blood pressure. Number two, it appeared to me that he may have suffered from anxiety. And three, it looked like he also struggled with substance abuse.
Other than those three conditions, did Mr. Floyd have any diagnosis of heart disease while he was still alive?
No, he did not.
So you said you looked at the medical records not only for diagnoses of pre-existing conditions, but also for evidence of medical encounters?
Correct.
And by that you mean hospital visits, clinics, etc.?
Emergency room visits, exactly.
What did you find in that regard?
So this is, in my opinion, was a really important part of the review as well, because every time Mr. Floyd had an encounter with a medical professional, I viewed that as an opportunity to see if there was any signs, symptoms whatsoever, even subtle, that could have indicated, for example, that he had anything going on with his heart. And so at the emergency room visits, he had one prolonged hospitalization. I really tried to take a look at everything. I looked at any opportunity I could to see if he ever complained of chest pain, which he did not, palpitations, which is a fluttering sensation of the heart. I reviewed all of the documented physical examinations of his heart to see if there were any abnormalities noted, and there were not, no murmurs, nothing found. I looked at all of his labs that get sent to see if there were ever any cardiac markers of injury, which he did not have. I reviewed his EKGs and his other tests. I tried to be as thorough as possible because I view this as I view what we do as a clinician in some ways as actually being a bit of a detective. And our job is to try to figure out what might be going on, even if it's not overtly stated so in the chart.
Would you tell the jury, by the way, what an EKG is?
Sure, of course. So an EKG is a shorthand for an electrocardiogram. That's the test where you'll see people put these little sticky things on the chest. We call them electrodes. And what an EKG basically is an opportunity at the surface level of the chest, but the technology is so fascinating. It can give you a glimpse into the heart itself to see a whole host of things, including is there any evidence of any heart injury happening now or previously, any abnormal heart rhythms, a whole host of other information that we can get from the EKG at that snapshot in time. And then sometimes what we'll do is we'll repeat EKGs down the line so we can compare and contrast and see if anything had changed.
So you looked at all of this medical information on Mr. Floyd, including the EKG. Did you note any cardiac problems that related to Mr. Floyd?
I noted no cardiac problems in the medical records as far as Mr. Floyd's medical condition was concerned, including everything I mentioned, the EKG, even a time where they put him on a continuous cardiac telemetry monitor, which they'll do sometimes just to see beat to beat if anything's going on. I reviewed that as well.
Did you see any evidence of Mr. Floyd having had any abnormal heart rhythms?
His EKG showed absolutely no abnormal heart rhythms. On a rare occasion, something you would call a PVC, which is a very normal finding. I don't know if anyone's ever felt their carotid flutter for a second or something like that. It happens to all of us. But absolutely no ventricular arrhythmias for the premature ventricular contraction. Sometimes people refer to it as a skipped beat. A really common for us to have those.
Mr. Floyd had any negative heart condition?
There was absolutely no evidence.
Condition?
So thank you for that question, because I think that's an area of confusion sometimes. So high blood pressure in and of itself is not a heart condition. High blood pressure occurs for basically two reasons. Number one, high blood pressure originates in the blood vessels of our bodies. Oftentimes it's genetically determined why our blood pressure might start to go up over time. If you have a strong heart, you can also generate high blood pressures, and so those two in combination. So why, well, so I'll pause there and can explain more.
Well, did Mr. Floyd have a strong heart?
So every indicator is that Mr. Floyd had actually an exceptionally strong heart because he was able to generate pressures of upwards of 200 millimeters of mercury on some occasions. We talked a little earlier about my role as a heart transplant cardiologist. One of the problems with patients when they need a heart transplant is the exact opposite. Their hearts are so weak they can't generate a high blood pressure. Their top number might just be 80. The reason why high blood pressure, though, is important, and it is important to treat high blood pressure, is because over time, if high blood pressure goes untreated, 10, 20, 30 years, the impact of that high pressure on the heart can eventually start to become a bit of a problem. So the way I explain it to my patients who come into the office and I talk to them about treating their high blood pressure is I say, remember, the heart is a muscle. So if you go to the gym and you pick up a couple of dumbbells and you start to lift the weights, initially it feels fine. In fact, you probably get a little stronger. Your muscle will likely get even a little thicker, a little bigger, which is exactly what it's supposed to do. And initially, that might actually be a really good thing. But if I came back, 10 years later and said, how's it going? You'd say, man, this is getting pretty tough. And then the muscle can start to tire out. So we do want to treat high blood pressure. I can't emphasize that enough. High blood pressure should be treated, but high blood pressure in and of itself is not a heart condition.
So we've talked about your review of the medical records. You told us that you also looked at video footage informing your opinions. Would you tell us what you were looking for in the video footage that you examined?
Sure. So my approach to the video initially was sort of similar to my approach to the medical records, meaning I wanted to just do some cursory inspection, observation, basic stuff. What did Mr. Floyd look like? Was Mr. Floyd talking? And if he was he talking clearly, coherently, answering questions appropriately? Did I notice any evidence of abnormal physical exams on the video? Actually, I was trying to look for as well. When Mr. Floyd was walking, did he appear like he was walking without difficulty, or was it looking like he was perhaps with low blood pressure and maybe going to fall down? I was listening for any opportunity I could to hear. He might say, I'm having chest pain, or I'm having those palpitations or fluttering sensations. Basically doing what I do when I assess any person for a possible medical problem. I was looking for any and all of those possible.
We focused on things that would give you any insights into his ability to breathe.
Yes, of course.
And the ability to expand what's referred to as his chest wall.
Yes.
Again, to refresh the recollection of
Okay, we kind of figure out where this guy's going. I'm going to go ahead and see if I can move up to the defense questioning of this witness. And the fact that they're calling Mr. Hall tomorrow, I think Mr. Hall is a defense witness, so it sounds like the state may rest today. This may have been their last witness, which is why they added him.
jury. What is the chest wall?
Yes.
Okay, so let's get the cross of this prosecution
Morning, Doctor.
witness.
Good morning. Thank you for being here with us today. Just a few questions for you. Shouldn't take too long. Just to confirm, you're not a pathologist yourself, correct?
I'm a cardiologist.
And the vast majority of the patients that you treat are in a clinical setting, correct?
Correct.
Meaning they're alive generally when they see you?
Yeah.
All right. Can we agree that it is a pretty common occurrence that people die who have arteries that are 90% blocked?
No, sir. Well, everyone dies eventually, but not from the 90% blockage.
People die every day who have a 90% blockage.
People die every day from heart attacks.
Well, there's a difference between a heart attack and heart failure, right?
Heart attack and heart failure, you are correct, are completely different terms.
Okay. So people who have a 90% blockage may have a cardiac event and may die.
As a hypothetical,
Yes.
hypothetically, there are undoubtedly people who have died from coronary events with 90% blockages or without blockages.
Okay. And people may not experience pain, right, as a result of an arrhythmia?
Correct.
Doctor seems a little defensive with this guy. He's not, he was talking to the jury before, he was smiling, now he's kind of seems on the defensive. Goes to bias.
And sometimes people have a 90% blockage of the right coronary artery and a 75% blockage of the left anterior descending artery, and they die, right?
Again, this is not this case we're talking about.
Exactly. Hypothetical.
In a hypothetical case, somebody who has any extent of coronary disease, including the descriptions that you just gave, could potentially die. Sure.
And again, they may have no pain associated with a fatal arrhythmia, right?
Fatal arrhythmias often are not associated with pain, in fact.
You would agree that Mr. Floyd did have coronary artery disease.
Absolutely.
How is that normally, in a living person, how is that normally diagnosed?
So usually the patient has symptoms. So they will have chest pain, or they're exercising, right? If you're an active person, you shouldn't have chest pain. And if you come to the doctor and say, something's not right, every time I try to exert myself, or it feels like the elephant on the chest is the classic description. So that would be one of many possible ways that you would diagnose coronary artery disease in someone who is alive.
May also do a stress test.
Sometimes.
A blocked right coronary artery that can contribute to a fatal arrhythmia.
Anyone can have a fatal arrhythmia with or without coronary artery disease.
And so if a blood vessel is blocked and blood is not getting through that vessel, what happens?
Well, it depends, but I'd like to answer that for you. So in the case of Mr. Floyd, what has most likely happened, based on our understanding of coronary physiology, is precisely because he had a narrowing of up to 90%, and it had calcium in it. We know that that developed gradually, and the heart is fascinating in what it does. It develops what's called coronary collaterals, which means the body makes additional blood vessels so that if there's one artery that's narrow, it recruits and builds many more blood vessels to supply blood to the heart. It's actually why you are more likely to die from a heart attack if you started with a lesser narrowed artery and the plaque ruptured and blocked the vessel than if you started with a more severe narrowing because of all these unbelievable coronary collaterals and adaptive responses.
Wow, so it's good to have blocked arteries. Okay, I got it.
That the heart does when that happens.
What is a safe dose of methamphetamine?
Prescribed?
Illicit.
I would never consider any illicit drug to be off the street that's not prescribed by a physician to be safe.
And methamphetamine is a vasoconstrictor, correct?
It often can act as a vasoconstrictor.
That means it constricts the blood vessels more, correct?
Yeah, correct. That's what vasoconstriction means. It narrows them down more.
You understand, based on medical records, that there's prior evidence of methamphetamine use by Mr. Floyd?
Yes, sir.
And methamphetamine can cause some changes to the heart in and of itself, correct?
Correct.
In fact, it sort of ages the heart more, right?
I've never used that terminology.
Okay. What does it do to the heart over prolonged use?
Every case is different, and it depends what we mean by prolonged use. So 1 day, 1 week, 25 years. Like most things, if you smoke cigarettes for 50 years, you're going to have more problems than if you smoked a cigarette or a pack every once in a while.
In terms of what does methamphetamine do to the heart itself?
So methamphetamine, if used over a long period of time, can sometimes contribute to the development of coronary artery disease, as we've been discussing. It can constrict blood vessels, as you mentioned. It can have kind of a host of different effects on various parts of the body, including the heart.
And there's lots of things that can make the heart work harder and faster, right?
Sure.
I mean, methamphetamine being one of them.
Yes.
Stress.
Vigorous activity being one of them.
Sure.
Adrenaline.
Yeah, I mean, we all right now have a lot of adrenaline flowing through our system. Adrenaline is needed for life, for sure.
Increases in adrenaline can cause the heart to work harder and faster.
Yeah, I mean, so adrenaline, which is the lay term for catecholamines, that's the purpose of adrenaline, is to get it to pump more blood. When we go and exercise, the purpose of adrenaline is so we can run and we can jump, and we ask the heart to allow us to do that, correct?
And have you, in your practice, worked with someone who has a paraganglioma?
I have had a couple of patients who've had what we call pheochromocytomas, which is a type of paraganglioma, yes.
In the hip area, generally?
No, generally it's actually near the adrenal gland, which is sort of just near the kidneys, but these paragangliomas can sometimes pop up in different places.
And how are they typically identified?
Well, so it depends. If it was clinically pertinent, that's how I diagnosed the ones that I've had. The classic findings are the person who's saying, I'm always having headaches. What is with these headaches? I'm always sweating. Why am I always sweating? You start to say, I wonder if something is releasing a hormone that can be contributing to that. Other times, like in my opinion, the case here with Mr. Floyd, you'll pick them up incidentally, say at an autopsy.
They're also often identified because it contributes to high blood pressure.
It can, that is right.
Oh, he just left that out. Even though Floyd had high blood pressure and heart problems, he forgot the high blood pressure part.
Have agreed that you've reviewed the medical records of Mr. Floyd, correct?
Correct.
And he has a pretty significant history of extremely elevated blood pressures, right?
Yes.
I think the one you referenced, that the top number was over 200.
Yeah, on more than one occasion.
On more than one occasion. And the lower number of the blood pressure was likewise elevated, right?
Yes.
Did you observe evidence that in the medical records that Mr. Floyd was taking prescribed medications to control his blood pressure?
I saw in the records during an emergency room visit that he was prescribed high blood pressure medication. What I could not see is whether he was taking them or not, but it did look like at one point there was a prescription given to him. I think one of them was for amlodipine, which is a calcium channel blocker, and one of them was for, I think, either hydrochlorothiazide or chlorthalidone.
And you
Seemed like a pretty good, honest answer. I mean, he seems like he's lightened up a little bit. He seemed a little stiff at first. Now he's seeming like he's answering pretty truthfully.
agree that the records that you had for Mr. Floyd were relatively limited. Agreed? I mean, they weren't his entire life medical records.
I don't know when he started to see medical professionals. So for all I know, the first instance in the records that I saw was the first time he started to see medical professionals. I'm not sure.
So how many years of past medical records did you review?
I believe 3 or so. I think the beginning of 2018 is when
Oh my God, that's a fucking bullshit answer. Are you kidding me? I don't know how long he's been seeing it. Could have been the first time. Yeah, he saw a doctor the first time 3 years ago. Really?
I think they started.
He lost credibility there with me.
Are paragangliomas ever removed from a person?
Paragangliomas, if they are causing those symptoms that I mentioned, the pulsatile headaches, the sweating, etc., a surgeon would sometimes remove them.
Would you prescribe an amphetamine for somebody who has a 90% blockage of the right coronary artery and a 75% blockage of the left anterior descending artery?
So first of all, I don't typically prescribe amphetamines. I have many patients who have coronary artery disease that are on stimulants, okay, for a variety of medical conditions.
Amphetamine is a stimulant.
So I just don't prescribe them, but I do have many patients with coronary disease who are on
I think he'd have been better. Do you subscribe stimulants to heart patients? He would have said yes. How about amphetamine?
stimulants.
Would you recommend to someone that they use methamphetamines with that degree of coronary artery disease?
I would never recommend that anybody take methamphetamine off the street for any reason.
That's called qualifying his answer instead of answering the question.
You aware of the research showing that deaths where both methamphetamine and fentanyl are found occurs at a much higher incidence?
Can you repeat that question,
Sure.
please?
That the research has demonstrated that deaths of those who use methamphetamine and fentanyl have been notably higher than meth or fentanyl alone. The combination.
Objection, Your Honor, for lack of foundation, assuming facts.
As to assuming facts, that is overruled. Assuming, is it the scope of his foundation? Since the state did ask him for toxicology opinions.
Sure, but the reference to medical articles on which anyone has seen is simply counsel's reference, Your Honor.
Overruled. You may answer if you know.
Okay. I'm not familiar with the breadth of the literature looking at all of the different combination of drugs and which combination worsens or improves survival.
You testified that Mr. Floyd, based on your review of the video, did start complaining of shortness of breath prior to being placed in the prone position, right?
Yes, I heard on more than one occasion he say the words, I can't breathe.
And if Mr. Floyd had simply gotten in the back seat of the squad car, do you think that he would have survived?
Objection, Your Honor. It's not calling for medical testimony.
You may give it if you have a medical opinion as to that. Overruled to that extent.
So had he not been restrained in the way in which he was, I think he would have survived that day. I think he would have gone home or wherever he was going to go had he not been subjected to the prone and positional restraint that he was.
So in other words, if he had gotten in the squad car, he'd be alive.
I think my answer remains the same. Anything other than that scenario that he was subjected to, I have no reason to think from a medical perspective that he would not have survived that day, correct?
Good
And
answer.
in terms of the prone position, you would agree that the prone position is not in and of itself inherently dangerous.
In an ordinary individual, if we were to take away everything else that was going on and someone was just simply lying in the prone position, while there are many patients who that would be inherently dangerous, the average individual, I would agree with you, probably just lying flat in that situation generally wouldn't be dangerous.
Even in the ICU, there are circumstances where people have serious medical conditions where they're maintained in the prone position. Agreed?
In the ICU, when patients are put into the prone position, it is when it is a desperate attempt to save someone's life where their lungs have actually developed what we call acute respiratory distress syndrome, or ARDS. They have a ventilator in to make sure that the amount of air that they get, no matter their positioning, will always be enough. And so it's a funny thing to think about putting someone in the prone positioning in the ICU on a respirator, but because of respiratory physiology, sometimes that will actually help open up certain segments of the lungs that are needed for oxygenation. But it's really important to keep in mind that they are on a respirator every single time to open up those lung airways, and they're usually on sedation as well to keep them comfortable.
Oh,
My last question,
that didn't
Doctor,
help.
is after someone's heart stops, is it possible that they continue to respire?
It is, well, I'm not sure I could answer that with certainty other than to say there are these things that are called agonal breaths. So when I'm in the intensive care unit with a patient who is dying and they go into cardiac arrest, once in a while you will see them take one or two extra breaths. I'm not sure the exact mechanism or the physiologic trigger for that, so you could potentially see some extra breaths for a short period of time.
By a short period of time, up to a minute?
In my experience, if the heart has completely stopped, I would not expect to see the breathing continue for up to a minute, but I might expect it to be seen for several seconds.
No further questions, Your Honor.
Any direct.
Pretty good witness. Pretty good answers.
Dr. Rich, you were asked several questions that had to do, or at least had as a premise, the blockage of Mr. Floyd's arteries. Is blockage a proper medical term to you as a cardiologist to describe the narrowing in Mr. Floyd's arteries?
So when we try to use a terminology that is not medical terminology, right, to explain these phenomena, the term blockage I tend to use when the blood vessel is completely blocked. There's a blockage. I will usually describe, if I have a patient like Mr. Floyd who has coronary artery disease like this, I will usually use the term narrowings because the blood is still getting through. In fact, the blood may be getting through just fine. There is no level of narrowing, in fact. Even a totally blocked artery, this is what's fascinating, that develops over time, the territory of blood that blood vessel was supposed to supply can still be getting enough blood because of those collateral vessels that develop. So I would use the term with Mr. Floyd as narrowings.
You were asked questions again about paragangliomas. I think you told us that those are usually preceded by headaches of some kind.
Classically correct.
One of the symptoms is headaches.
Yes, that is right.
Again, did you hear, amongst the various complaints Mr. Floyd may have had about pain, did you hear any of them being a headache?
No. In fact, when I saw that there was a paraganglioma described as an incidental finding in the autopsy report, I actually, when I went to the medical records, I used that Control F button to put in headache and make sure that I never found headache, in addition to scrolling through all the records. I didn't find headaches at any point.
When you reference paraganglioma being an incidental finding on the autopsy, would you tell the jury what's meant by incidental?
Sure. So all of us have things in our bodies that aren't causing any medical problems, but if they're discovered, let's say someone gets a CAT scan for one reason, they might find that there's a cyst on the kidney or the liver. Sometimes we'll even pick up benign tumors. So we refer to those as incidental findings. In fact, in the case of paraganglioma, the name you would actually call it is an incidentaloma, because we don't think it has clinical relevance, but it was found and described in the imaging, or in this case, the autopsy.
Are you familiar with any of the data as to how many people in the United States have ever died as a paraganglioma as the principal primary reason for death?
To be honest, I don't know the exact numbers. I just know that they are very low.
Again, the defense or the prosecution is always isolating each medical incident as if they're isolated. And they never take a totality of he's on blood pressure meds that he's not taking, he's got high blood pressure, he's got narrowing arteries, he's putting meth in there that hardens the arteries, he's taking fentanyl, which depresses the thing. They always want to isolate each one and say, to me, that's lawyer games and it's being dishonest. Omission of the truth is a lie. And to me, they're being dishonest when they do that.
Now, you were asked questions about high blood pressure, the role and impact of methamphetamine, paraganglioma, narrowing arteries. Can any of those things, in of and by themselves, cause someone to die without first...
Again, by themselves. But we're not looking at them by themselves. They were all being interactive at the same time with the drugs, the caffeine, the nicotine, the sobo, whatever.
Bring the heart.
Can you repeat the question?
Yes, what I'm trying to get at, whether we talk about high blood pressure, methamphetamine, paraganglioma, and the impact on the adrenals, narrowing of the arteries, can any of those things by themselves cause a person to die without first impacting the stoppage of the heart?
Well, the reason I ask you to ask the question again is because I want to make sure that I'm precise and clear here. High blood pressure can cause death in manners outside of the heart. For example, it can contribute to a stroke, which we know Mr. Floyd didn't have. And the other thing that can occasionally happen is this thing called an aortic dissection, where the aorta, the main tube that leads the heart, can tear. That can cause death. So I want to make absolutely clear, these conditions can cause death on occasion in areas not involving the heart, but most of the time, if death is going to occur by them, it's going to be caused because of their impact on the heart.
And did Mr. Floyd have an aortic dissection?
No, he absolutely did not, based on the review of the autopsy.
He didn't have a stroke?
He also did not have a stroke.
So again, just to be clear for the jury, with all the discussion about the narrowing arteries, meth, etc., was there any damage at all observed to Mr. Floyd's heart muscle?
Based on my review of all of the evidence, the EKGs, the autopsy report, I found absolutely no evidence at all of heart damage in Mr. Floyd's heart.
Thank you, Dr. Rich.
Any regrets?
Man, this witness made a pretty good case that it was a, positional asphyxia. It wasn't the heart. Again, we're ignoring the drugs and the heart, the drugs and the heart, and the fighting and the cops. Again, the state, the government, has to prove beyond a reasonable doubt above a moral certainty that it was the knee that killed Floyd. And I don't think the state's even done that. I think the multiple knees may have killed him, but that doesn't mean Chauvin killed him.
Heart disease, high blood pressure. On redirect, you were asked a question about the paraganglioma, the coronary heart disease, high blood pressure, if any one of those can cause death independently, and you answered relevant to the high blood pressure, right? But you would agree that when you combine a lot of that, you would agree that the body is, a lot of things are happening at the same time, right?
Yeah.
And in combination, if you have a paraganglioma, you've got an increase in the fight or flight kind of response. You've got coronary heart disease, you've got high blood pressure. all of those things combined could cause death, even if there was not a physical restraint.
Well, there's his paraganglioma. The likelihood that his paraganglioma was even releasing any hormone is highly unlikely.
But in terms of the combination, the drugs, the high blood pressure, take the paraganglioma out of it, right? The increase in adrenaline from a struggle with officers, all of those things combined together, even in the absence of
He's forgetting the drugs.
prone restraint, could have resulted in death. Yes or no, sir?
Upon my review of the evidence and facts of the case, I found no evidence to support that.
Fair enough. Thank you.
All right. Thank you, doctor. Thank you. You are excused. Thank you.
I think he was a pretty good witness, and I think he made some good points, and I'm not sure I would say he was overly biased or somewhat biased to. His bias lies, and he's already made a decision that he is very vocal about, that the knee or the positional asphyxia killed George Floyd. So any other alternative thing, when somebody says that killed him, that goes against what he's already predetermined. So his bias may live in his decision defending his position. I don't think his bias laid in, I'm trying to help the prosecution get a conviction. I didn't get that out of him. Just me personally. All right, we'll end that there.